Good morning everyone. So I'm here today with a small video for parents of young children because as I had mentioned in my earlier videos, I have been seeing a lot of young children with a lot of dental caries and decay which has only increased over time, and this in the long run requires a lot of dental work and treatment. So today I'm going to give a few pointers or tips which a lot of parents can follow so as to instill good oral hygiene habits and to improve the oral health of their children. So the first thing is for parents of very young children, please do not give your child a bottle of milk to go to sleep. I've seen this very commonly, that a child takes a milk bottle and then just goes off to sleep and keeps the bottle in their mouth for a long period of time. So what happens in this is the milk is in continuous contact with the teeth over a long period of time. This can result in a lot of caries or decay in their teeth. This is commonly known as baby bottle caries or rampant caries and is very habit forming. Once the child is used to sleeping with a milk bottle, it's very difficult to break that habit. So you should try and avoid that from the beginning. Secondly, please do not give your child milk with any kind of additives like even plain sugar or like a chocolate powder or any flavored powder. Firstly, they have no nutritional value. Secondly, they are loaded with sugar, which only worsens the oral health of the child and is again a habit forming thing. Thirdly, dietary modifications. So setting good dietary habits from an early age is very important for every individual. In case of children, to maintain their oral health and prevent cavity and other problems at a later stage, it is a good idea to instill these habits at a young age. So the first and most important thing is, as I've always mentioned, to limit the intake of sugar in the diet. Please try and do this from an early stage. Again, doing this at a later stage becomes a challenge. So sugar is not only in the form of chocolates, cakes and ice creams, they are also in our daily fruits, vegetables, everything. So you should keep this in mind, that a normal healthy diet has enough sugar for a child without the added confectionaries. Second is to limit processed foods. Things which are highly processed do not help in the oral health at all, because the child is not chewing or using his or her teeth in any way. And thirdly, to add a lot of fibers in the diet. So any kind of dietary fiber in the form of fruits and vegetables like carrots, apples, broccoli, they are very, very good for the teeth and the gums. And the more fibers which are added in the diet is anyway good for the overall health of the child as well. Fourthly, again, very important, and I cannot stress more on this, is brushing. Regular twice a day brushing is the cornerstone of good oral health. So again, instill this from a young age. Proper brushing, giving it adequate time. Brushing twice a day, both morning and evening, is something which every individual needs to follow. The younger you start, the better it is. And finally, something which a lot of adults also don't follow is flossing. Flossing is very, very important. I know that it takes a little time to get used to and to get the hang of it. So yes, when the child is a little older, say in their, a 10 or a 12-year-old child can easily manage to floss if you teach them. According to studies, they say that almost 35% of a tooth surface is not cleaned if you do not floss regularly. That is one thing. The second thing is the gums. The more you floss and clean your teeth with the floss after your brushing, it keeps the gums healthy and strong. So these are some very basic, simple things which every parent can, start teaching their child from an early age. This will, I would say, form the foundation of good oral hygiene and oral health over a long period of time, so that they do not have to repeatedly get fillings and other things, which then sets the precedence for problems at a later stage. Thank you.